Hip arthritis can be treated in different ways. In the early stages, when the symptoms are mild, can be treated without surgery. This includes physiotherapy, weight loss, vitamin D supplement, painkillers, and targeted joint injections. In more advanced stages, when the patient experiences more significant symptoms and pain that affect their quality of life and daily activities, we move more toward the surgical side, including full hip replacement or hip resurfacing. The hip replacement can be performed conventionally, as we've been doing for many years, and more recently we introduced the robotic-assisted surgery in hip replacement surgery. There are different types of implants: cemented implant, uncemented implant, ceramic femoral head, which is the articulating part of the joint. Each patient has his own demand and need, as well as the medical condition. And we would like to discuss all these options with the patient and come with a shared decision between the patient and us to provide the best available care to each individual and help them to go back to daily activities and to improve their quality of life. Most patients nowadays having their joint replacement done under spinal anesthesia. On the top of that, they will have sedation. This has significantly improved the recovery after joint replacement in terms of pain management as well as early mobility. In my practice, all the sutures are absorbable sutures, and the patient will have a waterproof dressing from day one, so they can shower, they can walk, and they return to daily activities as soon as possible. Most patients stay in hospital for one night and they will be able to go home the following night if they are safe and mobile. They may need crutches for the first few days for support. Most patients are able to go back driving for manual car probably in around 6 weeks time after surgery, but that depends also whether they're driving manual or automatic, and depends on the side of the operation. Most patients are able to go back to work between 6 weeks to 12 weeks time, depends whether the type of work, whether they're able to work from home or they need to commute, and the journey they need to take to go back to their work. While hip replacement is a very successful operation with satisfaction rate more than 90%, there are significant risks could be potentially associated with such surgery. Therefore, each patient will have a full pre-assessment medical check to ensure they are fit to have surgery. They will be given blood thinning medication to minimize risk of blood clot, and they are being given also antibiotics to minimize the risk of infection. And the patient will be educated about the potential risk and how we keep the risk to the minimum and work together to minimize these risks.